So hello, I'm Clive Morgan. I'm the Managing Director of the All Wales Medical Genomics Service. The AWMGS, All Wales Medical Genomics Service, it is a national service. So we cover clinical services, the patient-facing part, a really important part. And we also cover the laboratory section. So all of the tests that are done nationally. We also provide services for other home nations and internationally as well. We have probably about 200 members of staff, very diverse, lots of expertise. We have really, really talented individuals. But again, are coming together as a really cohesive service. We formed in 2019. Obviously, there's been a little bit of disruption globally, which has impacted on us. But we still continue to provide innovative services throughout all of this disruption. And I think we're all very proud of the fact that, during what has been a global pandemic, we've been able to respond to patient needs and deliver really leading edge services, which are innovative, novel. Some of them, again, have been the first time they've been done in the UK. So we're very proud of this fact, and very proud of the fact that, again, we are a national service, which again is quite rare. It's quite rare to have that reach.
My name is Sian Morgan and I'm head of the All Wales Genetics Laboratory. So we're a tertiary service and we provide genomic services for the population of Wales. So all the services that we provide within the laboratory are UCAS accredited. So we've got around 140 staff members, and it's a real mixture of clinical scientists, genetic technologists and bioinformaticians. And having that bioinformatic capability has been really, really paramount and of great importance for us to deliver next generation sequencing. And of course, that initial investment from Welsh Government back in 2018 for us to acquire a NovaSeq. We were one of very few NHS genetic laboratories at that point who had access to a NovaSeq within the service delivery. So that really made us stand out and increase our capability to really provide the exciting services that we are now delivering obviously for the benefit of patient care. Some of the services that NGS has impacted and we deliver within the laboratory at this moment are around prenatal diagnosis and reproductive medicine, and an example of that service is NIPT. For the rare disease, new services that we've just brought in line is the WING service, and it's a service for unwell infants. In addition, we have services around cancer. Our cancer services are stratified medicine cancer services, and one of the key services we delivered in 2020 was around NTRK gene testing. And lastly, another new area for us within the laboratory that we are providing testing for now is for pharmacogenetics, and a gene test that we delivered in 2020 around that was DPYD gene testing. So that just gives you some of the new services we're delivering where NGS has really impacted on the technology that we use to deliver those particular services. So our commissioning model, and we work very, very closely with our commissioners. We are now currently ensuring that we have equitable genetic testing between what is on the test directory, and that patients in Wales have access to the same testing as that of other patients across Wales. And I think that's a key deliverable for us as a service moving forward.
I'm Alex Murray. I'm one of the consultant clinical geneticists and I'm the clinical lead for AWMGS. We offer patient-facing genetic services to the population of Wales. Clinically, we're based in 3 teams. One, probably the hub for the service, is based in Cardiff, covering South East Wales. We have another team based in Swansea for the South West, and a team based up in North Wales, looking after the patients in that part of Wales. We're a multidisciplinary service, so as well as clinical genetics doctors like myself, we have genetic counsellors, and obviously we're very dependent on our admin and clerical team who provide all the support services to enable us to do our job. We also work closely on a daily basis with the laboratory team, and one of the things that we're particularly proud of is our ability to be co-located with the laboratory team and to work closely with them. So whenever we're developing a new service, or whenever the laboratory is developing a new service, it's very much a joint effort, so that there's always a sort of a clinical and a scientific aspect to those services that we're developing together. We also have a very close working relationship with all of our other clinical colleagues across Wales. I think because we're a small country, we have the ability to form very close relationships, and that's been really helpful in introducing mainstreaming services. So across various different specialties, cancer being one, but also other areas, we work closely with clinicians in secondary care to enable them to roll out genetic testing at an earlier point in the patient pathway, which brings about improvement in patient care. But we're there to provide support, education, and further cascade testing for family members when genetic testing is carried out in secondary care. So one of the things that we've been able to introduce in the last year is virtual appointments, and we're using a platform called Attend Anywhere, which enables us to offer online virtual appointments to patients. Previously, I would say the vast majority of our appointments were done face-to-face, but circumstances have made that more challenging in the last few months. And in fact, it's really just enabled us to introduce something we were always keen to do. So we now have the flexibility to offer patient appointments face-to-face where needed, but also by telephone or by video consultation. And we've been surveying our patients, and they've told us that they found both telephone and virtual appointments very, very satisfying, and we certainly plan to continue to offer this choice to patients going forward. So we'll always be able to offer face-to-face appointments when it's needed, but what we found is that being able to connect to a telephone or video appointments is much better for patients. They don't have to travel, they don't have to fight with the car park, and it can reduce the amount of time they have to take off work. So we're really pleased that we've been able to introduce that. As Clive mentioned, the AWMGS in its current incarnation came together in 2019. But obviously the genetic service in Wales has been around for decades, and in fact we have a very long and strong track history of providing genetic services in the UK, and we were one of the first centres in the UK to provide genetics services, and we have a very strong and rich history of research in genetic disorders, going back, as I say, decades, with former colleagues who have been integral in discovering genes for conditions such as Huntington's disease and tuberous sclerosis. And we continue to be involved in research and hope to continue to be at the cutting edge of new developments in genetics.
So as we've suggested, the AWMGS is a national service. But what is very important for us is partnership work, and we've been working on this now for quite some time. And back in 2017, Welsh Government published the Genomics for Precision Medicine strategy, and that very much described this collaborative relationship between the clinical services, the AWMGS, and PENGU, the Pathogen Genomics Unit from Public Health Wales Microbiology. We're incredibly proud of what they've managed to achieve in terms of sequencing the COVID virus. I mean, they are punching way above their weight in Wales. But also then collaborative relationships with academia. One of our key partners is the Wales Gene Park. That's hosted by Cardiff University. And the Wales Gene Park enable much of the genomic research in Wales. They're also very heavily into education and training programs, from schools up to sort of genomic cafes. So we're taking a societal approach to sort of genomic literacy in Wales. But also the strategy then describes partnership working with industry. One of the things that we're keen to sort of unpick, there is a policy thread in Wales. So it goes from the Genomics for Precision Medicine strategy to the National Pathology Statement of Intent, also the written statement on precision medicine, which describe very clearly that this need for collaboration, not just for better health outcomes, but for economic development. And one of the key things that we're looking to do through the genomic strategy is to co-locate the Pathogen Genomics Unit, the Wales Gene Park, and the All Wales Medical Genomics Service. Through this co-location then, we'll also link in like I've said, with the pathology statement of intent, look to create a regional pathology service which would link into a sort of a national construct. And we'd look to sort of set the hub in a location that we've sort of highlighted. To the north of Cardiff, it's a very strategically significant location, really good access to the M4 and the A470, which connects the valleys. And right across the M4 and into the A470, we've got a life science industry cluster. There's over 200 companies, about 8,000 jobs, with a turnover about 1.5 billion a year. So we're looking now to see what we can do to help and support this economic growth. We've had many conversations with sort of large global anchor companies and also SMEs. So what we're looking to do is lever the investment in health, through the construction of these new facilities. It's one of the explicit investment objectives. Create these new facilities that will lever sort of economic growth, because we know one of the key determinants for health is employment. And if we can create employment in some of the most socio-economically deprived areas in Wales, that will be a massive benefit, not just for the health of Wales, but for the wealth of Wales. We're looking at investment in technology as well. So Charla's mentioned the NovaSeq 6000. We've actually used that to sort of catalyse research and development in Wales and look at integrated research. So although it's our asset, it's used by academia and again, partnership working through Pengu. So we're starting to see ourselves very much as a single integrated service. We're not at the point where we're going to be able to deliver a single managed service, but that's what we're working towards. It's a very bold ambition for Wales, and we see it very much as a vibrant part of a vibrant precision medicine ecosystem. Cardiff is one of 6 precision medicine centres of excellence. That's not a title we've given ourselves. The UKRI, Innovate UK, have awarded us this title because there is something really interesting about the fixed assets, the things that already exist in Cardiff which support precision medicine. And we hope our vision, being led very strongly by Genomics, will pull all this together. So Cardiff will be a global precision medicine destination. That is our ambition, to do something globally significant. And we truly believe we can do that.